Kentucky health departments are seeing their operations return to the way they were before the pandemic. It comes as the COVID-19 national emergency ended last week.
WKYT's Phil Pendleton talked to the health department director in Mercer County on what this means for them.
For months that turned into years, it was all hands on deck at the Mercer County Health Department. But now with the COVID-19 national emergency coming to an end, so things can return to more of their normal functions.
Many counties throughout Kentucky will start their community health assessments now that the work with the coronavirus is not nearly what it was before. People will be asked to tell health leaders what services they need. Health departments will then make decisions on what to do with their local tax dollars. They hope to come up with a game plan for the next 5 years. This will be a priority, along with making sure that the children's immunization programs are fully running once again.
And so we've partnered with our schools here in the county to make sure that our kids are vaccinated. We've always done school-aged vaccinations, but this has just given us a reason to focus on it a little bit more.
Some things worked really well during the pandemic, other things needed a lot more work, but there also were some things that will likely stay the same, such as the practice of waiting in your car and calling in to get an appointment and not going into a waiting room. In Mercer County, Phil Pendleton, WKYT.
Well, health leaders say during COVID, personnel from other departments such as environmental or those who checked restaurants all transitioned into pandemic work. Now those departments are fully functioning again.